Hello, we are a group of medical students at the University of Groningen, and we are currently working at the UMCG at the Department of Rheumatology and Clinical Immunology. Our research focuses on axial spondyloarthritis, an autoinflammatory rheumatic disease. With the class cohort, we hope to deepen our knowledge of the disease and improve your patient care. However, we are aware that scientific research can seem a little difficult at times. Especially if you are not a scientist yourself, it can be hard to picture what exactly is happening and how you can help. So let's break it down for you. Axial spondyloarthritis is part of the larger family of arthritis. Spondylo means vertebra, or the bones of the back, and arthritis means joint inflammation resulting in pain, stiffness, or swelling. Axial spondyloarthritis is an autoinflammatory type of arthritis, which affects the spine predominantly, especially in the lower back area. It can manifest in other ways, for example, inflammation of the joints, the bowel, eyes, or skin, but predominantly there is the spinal involvement. Classically, it is a disease that begins insidiously, meaning quietly and slowly. Patient may not know they have it, and it takes years to make the final diagnosis. Inflammatory back pain is usually the main feature, which typically improves with exercise but not with rest. It starts in young adults, usually below 45 years. Somewhat more males than females are affected, and it can be more common within families. What are the signs and symptoms to look out for? Patients usually notice first that they have increasing stiffness in their back and back pain. This is usually worse at night and early morning, but improves during the day. The disease is characterized by the fascinating combination of new bone formation and bone loss in the spine. On the one hand, syndesmophytes, which are little hooks at the vertebral corners, can develop, and finally the vertebra can fuse, which is then called a bamboo spine. This can also be seen on conventional X-rays. On the other hand, there can be bone loss within the vertebra, resulting in low bone mineral density, also called osteoporosis. Why are vertebral fractures so important? Most patients know about the excessive bone formation in axial spondyloarthritis, but bone loss can also have serious consequences, as this can result in increased risk of vertebral fractures. Early diagnosis with radiological imaging enables us to initiate treatment early on, as one vertebral fracture is associated with the development of more vertebral fractures. Of course, the progression of the vertebral damage or bone loss must be closely watched with routine spinal radiographs and measurements of bone mineral density with a DEXA scan, which usually happens every 2 to 4 years. The X-rays are evaluated by a radiologist for spinal bone formation and the presence of vertebral fractures. Currently, there's a new development, a so-called VFA, which is an automated assessment of the vertebra, which can be taken together with a DEXA scan on one picture. The images and results are used for research within the Groningen Leeuwarden axial spondyloarthritis cohort, or for short, the class cohort. We hope that we shed some light onto your disease and our research. Thank you very much for your time.